everyone in the audience, please utilize the chat function. This is going to be an interactive panel. If you have questions within the audience that may not have been answered throughout the town hall, please ask them in the Q&A. You can also utilize the chat function as well. We're going to have staff in both the Q&A and the chat filtering your questions to the panel to be answered. We're going to try to get to all the questions that you may have, so please feel free. And the Q&A, I'm not sure if everybody's able to see it, but I'm pretty sure the Q&A might be anonymous, so that's also an option. Or you can send a direct message to me, and then I can filter that question to the panel as well if you wanted it to be anonymous.
Thanks so much, Jess, for those housekeeping rules. And with that, I think we can go ahead and get started with the formal program. So once again, I want to welcome you all. My name is Hilary Tsumba. I'm the Director of Organizational Strategy at the Primary Care Coalition. And over the past year, it has been PCC's great honor and privilege to begin working with the many organizations in Montgomery County that serve individuals with intellectual and developmental disabilities in coordinating certain activities related to pandemic response. It's just been a tremendous journey, and there are so many organizations doing wonderful work and so many advocates and champions for the community as well, including the Council Vice President, Gabe Albornoz, who is Vice President of the County Council and also Chair of the Health and Human Services Committee, and has joined us this evening to provide some opening remarks for today's event. So over to you for some opening remarks.
Thanks, Hilary. I will be brief because we want to get to the Q&A here, but I just wanted to not miss this opportunity to acknowledge this fantastic team of panelists that we have here before us. I really want to thank Dr. Bridgers and his public health team, who've done an absolutely outstanding job for so many months and now years as we have really struggled against this pandemic and tried to tackle and get in front of each of the respective waves. And we have another one here before us now. And so I also want to thank Dr. Mike Greenberg and all of our partners in the community who have been such steadfast supporters. I want to reassure our public that we are continuing the complete and total commitment in ensuring the health and wellness of all of our residents, but especially our IDD community, which we know has just been disproportionately impacted in so many different ways, not just with regards to confusion about vaccinations and boosters, but the social and emotional toll on our families has been profound. And so I want to thank all of you for your leadership, for your patience, for your grace, as we as county government officials have tried to sort through this mess, but have always felt strongly that we are in this truly, truly together as a community. So I look forward to the discussion tonight. I will stay on just in case there are any questions that I might be able to answer, but I defer to this remarkable and esteemed group of professionals here to answer most of the questions this evening. So Hilary, thank you so much for PCC and your role for partnership and alliance as well. And to Kim Mayo and Dr. Odile Brunetto, who are out in the audience, we appreciate their dedication and leadership. And of course, that of Dr. Kroll, who of course directs our Department of Health and Human Services as well. So with that, I yield back to you.
Thank you so much. And I am now going to hand it over to Dr. Bridgers to give us a bit of a update. I believe you had a few slides that you wanted to review with us this evening. So I will hand it over to you, Dr. James Bridgers, who is our acting public health officer for Montgomery County and leading the charge in some of our pandemic response. Dr. Bridgers.
Thank you, Hilary. And again, good afternoon, good evening to my esteemed panelists joining me this evening, also to the Council Vice President Albornoz for joining us in his opening remarks, and special thanks to Dr. Raymond Kroll, who again leads HHS for his support and guidance in public health, but not only in public health, but in our aging and disability services, where Dr. Brunetto and her team and Ms. Kim Mayo, who's been instrumental in supporting and pulling all of the information together, not only with our vaccination, but with our booster strategy. So having said that, I'd like to share and just have a few slides just to keep us all on the same page. And so within the Department of Health and Human Services, we like to keep a pulse on the community. And so Dr. Kroll has been advising our team to develop a pulse report, working with our PACS team and our epidemiologists to not only look at the vaccination rates, the cases, testing, and our booster strategies as well. We're vaccinating our 5 to 11-year-olds, and early on, in our vaccination strategy, you can recall that we had some challenges with getting test kits and getting tests in our IDD community to keep that community safe. And we worked with our Maryland Department of Health and our community partners. Again, special thanks to PCC for always their willingness to step in and support our efforts in vaccinations, as well as boosters and testing and providing support as well. And so why are boosters important? We know that, as Council Vice President Albornoz indicated, there is a uptick in cases, not only in the county and the state, but nationally. It was reported that Maryland has seen the most number of cases, 1,800 today, being reported as part of our daily update. And so we have a high vaccination rates, and we know that boosters are instrumental in combating any of the variants. The Omicron variant has just emerged, and we're still unpacking the data and the science behind that. But for the past 22 months, we've used data to ground our activities, not only in public health, but to look at those support services that are needed under the Health and Human Services umbrella. And as you see, over the past 4 weeks, we've had 2,396 cases. A small amount of those cases have been hospitalized, but what's most important now is those individuals who are 5 to 11-year-olds, where we see the more case rates. And we know that only 8% of those cases are due to outbreaks in school systems, so they are in the community. They could be in our IDD spaces, and we need to be mindful not only of vaccinating this community, but also administer boosters to this community. Our case rates still continue to impact those communities of color, our Hispanic and Black communities, and we know that residents of color reside in our congregate living spaces. And so we continue to use the data to look at our equity and our access framework, which has guided us from the beginning. We've learned many hard lessons from our vaccine and our testing and vaccine and our booster strategies. And this is definitely one community that we need to support. We need to continue to collaborate with our partners and to get additional shots in arms as needed. Montgomery County leads the state of Maryland in administering additional doses. We have administered over 214,000 doses, and we continue to administer those boosters in those communities in a targeted strategy. Again, looking at breakthrough cases and hospitalizations, we don't see a lot of breakthrough cases because of our vaccination rates, but we continue to monitor the data and look at those hospitalizations and those areas. Again, I talked about those pediatric cases, but in looking at those older members who may reside or in congregate spaces who are 50 to 64 years old who need boosters. And we also have gain support from our agency and disability services to administer homebound vaccinations to our community. So if folks aren't able to get out to us, we are going to them to put those shots in the arms, because we know that boosters are the key to suppress and or mitigate any further transmissions. We know that boosters work, vaccines work, more so in preventing deaths and severe hospitalizations. As our panelists will, I'm sure, share their experiences and that expertise in the science of public health. So what have we done? Over the past 22 months, we've partnered with our primary care partners to offer clinics and first and second shots. We've looked at the language to make it more accessible and equitable and culturally relevant to accommodate our IDD community. We've also identified those sites that could better accommodate our special IDD needs, such as not wearing masks. We understand, and the community may have additional accommodations. And again, our A&D service area has been very complimentary in keeping us culturally aware of the needs of our IDD community. And again, ongoing outreach. We want to get folks in, such as this town hall meeting, to provide education to individuals and families about not only boosters, but the efficacy of boosters, the importance of boosters, any other questions that you may have this evening. Initially, when we did a town hall early in the year, we had 548 people attend, and that's a great number for individuals to come out to listen and to learn and to share their experiences with us to help us do better in what we do. We've accommodated folks, as I indicated, through our helpline. The number is 240-777-2982. Now, I asked the audience if they contact us via the help desk to be patient. We have received calls regarding vaccines versus testing versus boosters, and we humbly ask that you leave a message. Someone will respond within 24 hours, but we want to make it, again, accessible. We look at whether or not there's special access to entrances to clinics. And this is what we need to hear from the community. What are those spaces and things that folks need to not only to be able to come to our clinics to receive a booster, but for us to come to you to be able to access and have access and get more shots in arms, whether or not there's safe spaces designed for individuals with sensory issues, or whether or not we need to deploy a home vaccination van, which again is in collaboration with PCC and the Maryland Department of Health. And then our current booster efforts. We conducted a survey with our providers to assess the needs, and with clinic to administer boosters. And we had a high response rate for individuals. And this is what they said. Many said that they needed assistance. Many providers have partnered with local pharmacies and grocery stores. Safeway has been a great partner in not only our testing, but vaccination and our booster campaign that we have. And we entered into these agreements to help increase and bolster our education and outreach activity. There's an upcoming clinic next week at Safeway on Darnestown Road from 9 a.m. to 1 p.m. on the 9th, and then 9 a.m. to 1 p.m. on the 12th. And we continue to provide services and support resources via HHS in our licensure and regulatory service area under the public health umbrella, and in our aging and disability service area. Then lastly, one of the questions to the panelists was, why do you feel that it was important for you to be on this panel? Well, I have a brother who had special needs and died in a rural hospital due to a lack of access to care in 2005. And so I continue my advocacy and support to the IDD community for him. Thank you.
Thank you so much, Dr. Bridges, for your great overview, grounding our discussion in what's happening in Montgomery County, and for sharing your personal testimony as well, and the passion that brings you to this work. And it's a great introduction, in fact, to the rest of our panelists. So I'm happy to provide an introduction. And what I'll do is briefly mention your names and organizational affiliations, and then I'll invite each panelist to also answer that same question about what brought you to this evening's event and why did you feel like it was important to be on the panel today. I'll run through all of our panelists' names first, and then I'll hand it over to you. So in addition to Council Vice President Albornoz and Dr. Bridges, who will continue on with us this evening, we have Tiffany Taliaferro, PharmD and pharmacist with Safeway and the COVID-19 vaccination clinic lead. Dr. Carolyn O'Connor, who is with the Montgomery County Medical Society. Sue Hartung, who is a parent of children with intellectual and developmental disabilities and an IDD advocate, and Dr. Suzanne Rubchinski, who is Associate Chief Medical Officer at the Kennedy Krieger Institute. Thank you all for joining us this evening. And in no particular order, just whoever speaks up first, I just invite all of you to share why you felt it was important to be on this panel this evening.
Yes. Oh, go ahead, Tiffany. I'm sorry, please.
Yeah, I can definitely begin. The reason I thought it was important to be on this panel today is because I just wanted to be part of the solution with the pandemic. I feel like there's a lot of misinformation, and I just wanted to provide any clarification that I could provide and make sure that your health and what's important to you, it comes across today to everyone.
And I'm Dr. Carolyn O'Connor. I'm a family physician in Rockville, and also, as Hillary mentioned, part of Montgomery County Medical Society. I was proud to have participated in the town hall that was held on January 27th. And it's hard to believe that that's 11 months ago. And here we are talking boosters. But I think that speaks to how successful the original round of vaccines was. And I'm excited, you know, as a family physician, we're all about preventive care, and vaccines are a cornerstone of prevention. And I have been advocating for vaccines in my practice. We are doing our vaccinating our own patients. So we're excited to be part of the solution along the way. And I'm just so honored to be part of this esteemed group tonight. Thank you for inviting me.
I'm Dr. Suzanne Rubchinski. I am a pediatrician at Kennedy Krieger Institute up the road in Baltimore. And we serve all ages of students and patients with intellectual disability, neurodevelopmental disabilities. And for the last 22 months or so, I've been the COVID-19 task force leader at Kennedy Krieger. So my focus has been all COVID, and not only from an infection prevention angle, but also running our COVID-19 vaccine clinics. So I've been committed to that from the beginning, and would like, you know, happy to share experience, happy to invite you to Baltimore if you need it, but I'm sure you're well covered here in Montgomery County. And just if, you know, like everyone said, we want to be part of the solution and move things forward and share information. And thank you for having me.
I'm Susan Hartung, and just to be included in any group that, in such an esteemed group, is not an adjective I usually use with any panel that I'm on, so I'm very honored to be here. I thought raising 2 children with intellectual and developmental disabilities was the hardest thing I would ever have to do, and then COVID came along. And my professional background is in this area, and I had seen over the last 40 years so much progress that had been made with this population and getting them truly included in the fabric of their communities, and just watched it for my kids absolutely evaporate for all good reasons overnight. But then to see how this booster has changed their lives and our lives, just to have them home for Thanksgiving and not watch them celebrate it on Zoom, was such a thrill for all of us this year. So I'm very happy to be here. So thank you for inviting me.
Thank you all so much. So I'm going to move through the questions. All panelists had received the questions previously. And so I'll probably direct a question initially, but then invite others to build on the first responses. And so our first question is perhaps seems straightforward on the face of it, but may not be that straightforward in this case. And that is, what is a booster shot and who should get it? And so I think that there's both the clinical ways to think about what a booster shot is and who should get it. And there's also sort of operational ways to think about it. So Dr. Telefera, would you start us out with that question? What is a booster shot and who should get it?
Yeah, great question. So as we all know, vaccines provide protection against viruses and bacteria. So when you hear about a booster shot, that typically means that the person received a vaccine, they completed the series. So in this case, it would have been 2 shots if you had Moderna or Pfizer, or 1 shot with Johnson & Johnson. So that series had been completed. And then after some time, to build stronger immunity or to build stronger protection against the vaccine, they come back and give you another shot, which is considered the booster shot. Who would require it? I would say, honestly, everyone over the age of 18, whether they have underlying health conditions or not. If you have Moderna or Pfizer, I would definitely recommend it for you if it's been over 6 months. And if you're over the age of 18 and you had Johnson & Johnson and it's been over 2 months, it's definitely recommended for you to get that booster shot, which is just another shot to increase that immunity.
Thank you so much. And part of that response was, your recommendation, everybody if you're over 18. But I can imagine that there could be particular questions for people who may have a disability or an underlying health condition. So this is, again, a dual question. So I'd like to hear from Dr. Rubchinski and then also from Ms. Hartung about why is it important if someone has a disability or lives in a group home setting to receive that booster shot, both from the clinical perspective and then also from the experiential community perspective.
So I'll jump in. So with the booster shots, with the regular series, sorry, let me go back. It was very highly effective at preventing severe illness and death in people with intellectual disability. And that was a high risk group. The other high risk group are older people. So over time, the immunity that's provided, so the protection from the initial series, or if you got the Johnson & Johnson vaccine, your 1 shot, decreases over time. So it's very important to get that boost and to bring up your level of immunity again. In terms of protecting, you're not only protecting yourself, you're protecting everyone around you. And if you live in a setting where there are other people with you, you want to protect them as well.
I just want to say to the staff that worked with my children and all our children in this community, did their job is hard enough, and now they've had to do it for 2 years wearing protective gear up and down 12 hours a day for shifts. It's incredible. What I kept for so many reasons, I got my kids their booster the minute that they were eligible. Mostly what I kept coming back to was, if they should get sick, my children are so tactfully defensive. For them to be able to cooperate just with oxygen or any of the care that they would need would be so difficult that, to me, the idea of preventing that situation from arising was kind of a non-question for us. I've been in the hospital with my son many years ago where I just actually had to hold the oxygen underneath his nose because he would not tolerate wearing it. And then he wasn't nearly as ill as he might have been with this. So I'm very grateful both my kids came through with nothing, but they were exposed several times because the staff has to go home back and forth to their families. So there's only minimal prevention that could have been done. So I think it's kind of imperative for our population.
Thank you both for those insights. The next question is one about timing, which is, why is it important to get a booster shot now? And so to some extent, there is a question of math, where a certain period of time since the initial doses became available. But we also know that for our younger kids, those initial doses are just happening right now. And so, Tiffany, from an operational perspective, why is it important to get a booster shot now? And what are the types of things that you're seeing and thinking about in terms of the ongoing needs related to boosters and this vaccine?
So I think it's really important to receive the booster shot because what they're seeing is that the protection of the COVID shots do not last completely. They're not sure exactly how much protection there is after a couple of months, but what we are seeing is after 6 months, there is a decrease in that protection. So that's why we really want to encourage everyone to go ahead and receive that shot so we can protect everyone from COVID as well as increase that immunity so we're not just spreading around the virus. What I've seen in from an operational standpoint, I sit through a lot of meetings with the CDC and the Department of Health, and mostly just the charts of essentially what I just explained, that after a couple of months, we're just seeing that decrease. So we really just want to urge everyone that decrease is there. It's not, what is the word? We don't know exactly how much it's going to decrease, but we are realizing that it is there. And so in order to get everyone fully protected, we're definitely encouraging everyone to go ahead and get the booster. I'm not sure if I answered the second portion of your question. You don't mind repeating it?
Sure. The second portion was, it's a little bit like, if you look into your crystal ball and think about the future, you know, what are the things that you're thinking of from a pharmacy and operations perspective around managing the need for boosters for people on an ongoing basis, people who have received their initial vaccinations at different timeframes, different age groups being eligible for vaccination at different times, and so it's sort of like anticipating what the future may hold in terms of volumes and demand for receiving those booster shots.
So, of course, this is new, so we really don't know what to expect. I do know, like we said, the protection does decrease. Well, we're just now vaccinating children, assuming that something similar would happen to them. We possibly may have to provide a booster shot for them in the future, but the literature is really not out there. What we're thinking may happen, because children don't typically get the same type of response that adults get from receiving COVID, is maybe this will be just a 2-shot series for them, and maybe they'll be finished, but we really just don't know. So we want to anticipate, you know, everyone maybe having to get a booster maybe in the future, and that we just stay ahead of that. And that when you think of a booster, don't just think of I'm protecting myself, but I'm also protecting the child who can't get the booster, or the person who's not able to make it to the pharmacy. So think of it as a whole, that you have to do your job to protect yourself, but also protect those around you. And if that requires you getting that booster to help that other person, that's something selfish that we should do to assist them.
And Hillary, if I may add to Dr. Talaferro's comment, it's just that we should think of the booster as not only protecting ourselves, but others. We know that individuals in the IDD community may live in congregate spaces where they may be around others at different ages. And we know that the literature clearly indicates that as we get older, our immune response changes, and the vaccine may wane over time. And so if we're younger, it may not be as needed as we are older. And we know that there are many different age ranges across the spectrum for individuals who may be in any one setting. And so we should not only consider that, but also consider how it impacts us, our family, those members who we visit, or individuals who may visit us. And I think it's very important to note that the boosters are important to not only protect us, but enhance our body's response to respond to any of the variants. We know that the CDC hasn't published, as Dr. Talaferro said, any recent data. And I know one of the questions is about the variant, but we know that the boosters and the vaccines have been effective in supporting our immune response to the variants. We've had about 14 variants in the Greek letter, and there may be others to come, but if we continue to be vaccinated, we continue to get boosters once they are clinically approved, then we should continue to do so.
Great, thank you for that addition. And it's actually a wonderful way of teeing up one of my questions for you, which is, you know, it's that true public health question. And it's a little bit of a challenging one, because, you know, some of the things that we're hearing or seeing in common discourse is an argument that says, you know, well, why should I get my booster shot when some people haven't even received their initial vaccines? So from that public health perspective, Dr. Bridges, how would you respond to that kind of a question?
So from a public health perspective, is very simple. The vaccines are effective. The data is grounded in the efficacy of its effective, be it 94%, be it 90%, even with the additional clinical trials that are ongoing now for 16 and 17-year-olds. And so individuals should become vaccinated. We know that those individuals and the data and the epidemiologic profile that we're seeing under public health, that those individuals who are unvaccinated continue to experience the most severe cases of responses to COVID and even death. And that's very unfortunate. So we continue to encourage all to get their initial series, as Dr. Rubchinski said, or their boosters, as well as Dr. Telefero said. Boosters are important. So from a public health perspective, it's similar to any vaccine over time that we continue to see in the community. Vaccines work. They are clinically proven and sound.
Wonderful, thank you for that. And I want to just remind all panelists, just as Dr. Bridges just did, anytime you want to jump in with additional points building on one another's comments, that's terrific. So please do feel free to do that at any time.
Well, on that note, I was just going to say that, I think Dr. Telefero would agree with this, as long as there's enough vaccine available for us to continue to vaccinate those who step forward, who maybe were hesitant to begin with, they can get their vaccine, but the people who are ready for a booster, timing wise, they can still get theirs. I think that this takes a public health perspective because as we know, the unvaccinated are people that are giving this virus fertile ground to mutate and change, and that's where the variants come from, is a largely unvaccinated population. So we all need to do our best to protect ourselves, but as in doing so, we can maybe, and I certainly don't have a crystal ball, but hopefully one day see this thing disappear or maybe just become a very low level background kind of problem.
And so thinking about that, I mean, you all have laid out the strong case for why getting to a vaccinated status and maintaining that vaccinated status through booster is just so critical to our ability to fight this pandemic. Dr. O'Connor, I'm curious to hear from you. Are there any reasons that anyone should not get a booster, for example, because of a pre-existing health condition? What kinds of conversations should people be having with their personal and family physicians about the booster and vaccine for them?
As far as I know, the only true contraindication is a severe allergic reaction to a prior dose. And I have not seen that myself, although I believe that they're within our entire practice of several thousand patients. I was told of one patient. But I think, and there is the example where if for those who can't take the vaccine, whether it's the youngest children or a patient such as that, for the most part, everyone else should be vaccinated, should take the booster. If a patient with a particular situation, if not from their primary care perspective, but I have had one or two patients where they had a specialist who felt that this particular patient needed to postpone vaccine because of an underlying condition. And, of course, we abide by the guidance from our specialty physicians. And, but on the other hand, for those who are just harboring some misinformation, which Dr. Telefero also alluded to earlier, I do my best to dispel that and encourage and beg and cajole and answer questions. And I just am trying so hard because it breaks my heart to think that one of my patients could be severely affected or worse because of misinformation that they had read or were told.
Yeah, that's absolutely critical. Your response prompted two things. One question that I'd like to ask, which is off script, and that's about the severe allergic reactions and the risk mitigation strategies that are in place at vaccination sites in case that happens. Dr. Telefero, Dr. Bridges, I know that both of you are very involved in sort of thinking through what needs to be at those sites. I know, my own experience, the wait 15 minutes. Can you talk a little bit about what is in place in the instance that someone might have an allergic reaction?
So I'll start, Dr. Telefero. So at our county sites and any points of distribution clinics that we have in the community, or even supporting our community partners, we have first responders there to administer basic life support, life skills, BLS, and we have fire and rescue paramedics there. We have EpiPens available. We have observers for once an individual gets vaccinated or their booster. We have a 15-minute wait period. We have an area separated from the clinical administration of the vaccine so that we can identify them and watch them. We have them socially distanced, of course. Individuals are wearing masks, so we have all of those layered, preventative measures in place. We ask individuals if they are unable to articulate their concerns, if they could use hand gestures, body gestures. We have bilingual staff there. In some instances in our IDD community, if we have hearing impaired or vision impaired individuals there, we have support staff there in support of our agency and disability services, who keeps us in contact and grounded with those culturally relevant clinical needs for the community. So from HHS perspective, and we still are learning what's needed, and we ask folks to advise us whether or not it's accessibility, whether or not it's response, whether or not it's a particular need. And so again, there's no playbook over the past 22 months, and we continue to not only use what the clinical guidelines are saying, but what folks are specifically saying their needs are from an operational standpoint.
Yeah, and just to piggyback off of that, I think I've seen about 30,000 people come through my facility. Having allergic reactions, severe allergic reactions, is very uncommon. I know you often hear it about in the media and on Instagram and Twitter, but I honestly can't say that I've seen them. Most of the people that I see are typically nervous, and the type of side effects they experience refers to that, like the sweating and like the shakes, but it's not actually caused by the vaccine. But we are medically trained, we are pharmacists, we are nurses, we are CPR trained, we have BLS, we are EpiPens on site, and we have people watching others to make sure in the observation period that if anything occurs that we're there. Also, especially at our Safeway sites, our pharmacists go through your paperwork very thoroughly. So if you are filling out your consent form or filling it out for someone else, make sure that you're filling it out honestly. If you mark on your consent form that you've had an allergic reaction to a vaccine, regardless of what that vaccine is, even if it's flu, we're going to sit you near us and we're going to watch you for those 15 minutes. We're not going to put you in the observation room because we want to make sure that you're going to be safe. And the best way to make sure that is to keep you with us. So we have a lot of protocols available for people. Like I said, just make sure that you're being honest on your consent forms. And if you're feeling uncomfortable about something, definitely tell the pharmacist, tell the nurse, tell the medical staff of any issues or concerns that you may have so we can address it. But in general, I have not seen too many severe allergic reactions or happening at our clinics.
And that's been my experience too. I would say after you, if there's any concern or doubt, talk to your primary care provider and talk through what happened and really go through it, because I think a lot of people are confused about what allergic reaction is, like you're saying, and it may be that it was anxiety or they didn't have breakfast and they were feeling a little dizzy and woozy and they needed some juice or something. And just talk through and make sure you understand what happened and why it happened and how to move forward, because yeah, it's very unusual to have a severe reaction.
Great. So the important thing I'm hearing in that is, what has already been said. The vaccines are safe and effective. The booster is safe and effective. And although allergic reactions happen, they're very rare, and there are measures in place to keep you safe in the rare event that could affect you. So important to underscore those messages. Here's one from the audience, which is about, as we're going into the holiday season, if you could advise on the guidance for vaccinated and boosted adults with IDD who may be visiting over the holidays, perhaps leaving their group home setting into a place where there are children in the 5 to 11 who might not be fully vaccinated, or even younger children below 5 who've had no vaccination at all.
Well, I think every family has to make decisions on, it's almost impossible to be 100% certain that you're 100% safe and nothing could happen under any circumstance unless you live on a desert island and no one comes to visit. But I do think that you can be rational, and I think that people need to be honest with each other about whether they're vaccinated. I think as far as young children, it's a question that each family has to look at. There is the adjunct of testing could be added to the equation as families make decisions. Again, it's not going to be 100%. And with the wider availability of home tests, and I'm very optimistic that we're going to have that added layer of protection now that we haven't had till recently.
Dr. O'Connor, you must have read my mind, because HHS is working on a plan in partnership with PCC in their booster clinic campaigns. We are putting together a plan. We know that there are particular spaces using our equity framework and access framework, and we know that there are individuals in the IDD community who may not be able to get to testing spaces, or who have relatives visiting them in congregate spaces. And so we are working as part of that plan we received home test kits from the Maryland Department of Health, and we are going to share those with our community partners so that we can have a wider safety net and access. And using those kits in this particular space during the holidays will help, even as you indicated, provide another layer of protection. So we're on the same page on that one.
Yeah, I would add in that adult with IDD who's had a full vaccination series and a booster is as safe a visitor as you can get, really. I would be more worried about your relatives who are not vaccinated and focus on them. And really, like Dr. O'Connor said, you have to do your risk benefit analysis as a family and decide, do we want, Uncle Jim to come? He hasn't been vaccinated, and we have baby here, and do we want to risk it? So, and it's really, really tough. And it's been really tough for a lot of families who have the discrepancy in values about the vaccine and all the misinformation. It can be really, really challenging, and can lead to problems in your family. So it's a lot of discussion, but I think encouraging all families to talk, which can be challenging, and be honest with each other is the way to go. And test if you can. Definitely, that's another thing.
I was heartened to hear Ms. Hartung say that her Thanksgiving was so much nicer, and my family too. I had Thanksgiving 2020 with just my husband, and this time we did have family together. Everyone was vaccinated. We don't have any children, small children, but it was a joy.
And so definitely some great guidance in there, and risk mitigation strategies that we can all think about as we go into the holidays, and finding that way to celebrate, to be connected, be with family, and still be safe. So thank you all for that. Another question that came in from the audience has to do with sort of providing some insight to the extent that we can on some of the new variants that are coming out. Obviously, Omicron is the big news of the past week. And prior to that, we had concerns about the Delta variant, the very aggressive Delta variant. As we think about the booster vaccine, how do we know, how much do we know, and how will we continue to learn about how effective it is against some of these new variants?
I think that the only thing that will work is time. There is no way to predict. And, you know, the news media sometimes amplifies. And I think that we have to stay calm and focused and not run into a panic, because that most of the time panicked people don't make good decisions. And whether it's Omicron or some other one farther down the alphabet, we're all learning our Greek alphabet, which is valuable knowledge. But and I shouldn't make a joke. I'm sorry. I apologize for that. But I do think that we don't know, and there are other questions that come up, like that we simply don't have the data. And even though we have these super smart scientists who will say, oh, there's so many mutations on the virus versus what some prior virus variant had. No one really knows for sure what that's going to mean in reality until a few months go by, I would think. So I think we just have to be patient and do the best we can. I mean, remembering that these are the tools we have at the moment. And, you know, of course, in the future, each year, the flu vaccine is changed to try their best to anticipate what flu strains will be circulating that given year. And the same kind of modeling may come to us at a future time for COVID. But for today, we have these vaccines at this time, and we've got to use them.
Dr. O'Connor, I would agree wholeheartedly. In looking at the journal articles that are coming out and the responses from the field and the scientists and all of the experts regarding that. But one thing I can say in looking at the literature that I've read and the news articles that I've read over the past couple of days is those particular cases, 2 cases that were identified, I believe one was in San Francisco and one was in Minnesota. There was moderate response to that. The folks were vaccinated. So that speaks to the efficacy of the vaccines. And so we still need to continue the message again, which is important to have this town hall regarding the efficacy of the vaccines, but not only vaccines, but the boosters as well. And so we didn't have this time last year. We didn't have the vaccines. Folks were we saw significant higher levels of hospitalization, and our death rates continue to soar. This fall, as you indicated, during the holidays, we're able to gather with family and friends. And so we're able to do that. And so again, which speaks to the necessity for us, inclusive, to be vaccinated and receive a booster.
And really the time is now to get the booster, given flu season, people are inside more and those celebrations. So it's really the best time in the next few days. If you can get one, go for it, definitely, if you're eligible at this point.
Wonderful, thank you for that. And I actually have a follow-up question. So this is taking us back to our conversation about the holidays and being at home for the holidays. And so this is from an audience member whose agency does have people able to go home, and they're asking that the family would have their residents tested and return to the group home if the test is negative. And there hasn't been any challenge in implementing that policy, but they're just seeking some clarification on the efficacy of that. Is that a good approach to say, as long as you're testing negative, come on back into the group home after the holidays? Or does the panel have any other advice on that?
I think it's a sound way to go. I would not, nothing is 100% guaranteed. So you might do the test and then someone could turn up positive, but getting that test, I think, is a really good idea. We test everyone who goes to the hospital gets tested before admission as part of an admission. So I think that's very reasonable.
Can I just add that I don't see that being much of an issue, in that staff who supply the support to those homes will be going back and forth to their homes almost on a daily basis. So the issue of contact, I think, is always present both ways. And I just want to say, off topic a little bit, I really want to commend Montgomery County. I think everybody here has done such an amazing job of keeping our county safe. And that's why I think the booster is so critically important. I don't think you have to go far beyond Montgomery County to see that people are not taking this nearly as seriously as the residents of Montgomery County are. Not only just in mask wearing, but in the booster rate and just staying healthy. And as a mom of two individuals who this could take a whole much dire direction than for the average person, I'm very much appreciative of it. And, but as far as the group home issue, I don't see that being an issue on either.
Thank you, Sue, and I 100% echo that sentiment in terms of you know, the hard work that everyone in Montgomery County has done. It's a sign of great leadership, and just as important as strong leadership is strong followership in a situation like this, and the community really banding together. And so that has been wonderful to see. A practical question, and this is sort of clarifying the information. What's the deal with mixing different brands for the booster? The guidance has been a little bit confusing. At one point, it was okay to change brands. At another point, it was not. Could the panel provide some clarifications about if you had Pfizer or Moderna for your first dose, what you might do for the booster?
It's my understanding that you are allowed to switch brands, and I think that is helpful, because the last thing we want is to turn people away and delay them getting a booster because maybe they don't know what they had. I don't have my card with me. Well, we'll give you a new card. Well, but I don't know which one I'm so relieved. Nothing has relieved me more than when the CDC and the FDA said that you could change, you could mix and match. And I've had patients do that because our office is only able to provide Moderna because we do not have the ultra cold freezers to do Pfizer. And we have patients that have gone every which way, from J&J to Moderna to Pfizer. Patients that read ahead and got Pfizer at their pharmacy, or they come to us getting Moderna, and it's worked out great. And I'm so relieved. And I think for those who had J&J, I think, including my husband, who happened to be one of those people, I think they felt an added measure of security to get the mRNA vaccine as their booster. So I'm just, that was one of the happiest days. And the other happy day I had was when they said everyone 18 and over is eligible, because I was just didn't really like saying no to anyone who said they wanted a booster and so we got that going as well.
And just to piggyback off of what she said, definitely the boosters are interchangeable, but the CDC still recommends that you complete the same 2-dose series. So if you start off with Pfizer for your first dose, it's still recommended that you get Pfizer for your second dose. It's when you get the booster shot that it's interchangeable. I know that's a little confusing to people, especially with all the new literature that's coming out, but make sure that you're still trying to stay with that same series, the same vaccine for that initial series.
Thank you so much.
Important point.
Thank you for bringing
especially
that up.
I know that I and many of my friends, we have been going through the coordination of getting our children vaccinated in their first round and our boosters, and trying to keep track of it all can be a little confusing. So that's a very important clarification. Thank you.
Hillary, if I could just add something, one of the big challenges that we face is still vaccine hesitancy, and you mentioned children. That's the next big group where the push to get vaccinated, those younger, is important. And one of the questions I get a lot of times from parents with young children or from young adults is, well, why do I really need the booster? Why do I need the vaccine? You know, if my kid gets it, he's probably going to be okay. And technically, they're probably right, you know, from a statistical standpoint. But one of the things that I try to point out is, by necessity, we've been very focused on the acute effects of COVID. What happens now? What happens in 30 days? What happens in 60 days? But what we're seeing, and what we don't really know as much about, I mean, I'm seeing it in my cardiology practices, there are many longer-term sequelae and effects of COVID infection that we're really not fully aware of. It probably won't be for a number of years. So I'm seeing many patients that have cardiomyopathy. So it may be that 30-year-old who didn't get vaccinated because he thought he was fine, but 2 years later, he's got a weak heart. My colleagues in neurology, in nephrology, are seeing the long-term sequelae. So one of the things that I try to talk with parents about when they're debating about their children or young adults is, you know, just being infected with the virus may have very significant long-term effects that we're not aware of. And that the inflammation that your body goes through, you may be fine now, but you may have problems 3-4 years down the line, whether it's with kidneys and so forth. And that does seem to resonate, because many people with vaccine hesitancy, part of that hesitancy as well, we don't really know what are the long-term effects of the vaccine. Well, we're pretty confident about the vaccine, but when we talk about the same question, what are the long-term effects of having your child or young adult get the infection? So I just think that's something important to think about. And there's more and more emerging data that the long-term effects are going to be something we're going to have to deal with down the line. Thank you.
Dr. Greenberg, that's a really important point, and I know that you and I have talked at times about the impact of those long-term effects for people specifically in the IDD community, where there may be other complicating health conditions and health factors as well. We are just getting to the top of the hour, and so I was preparing to hand over to you for closing remarks. And so I wonder if you could address that question and sort of some of the considerations about long-term effects of COVID infection for individuals with IDD. And then if you provide your closing remarks at that point, that would be wonderful. Dr. Greenberg? You're on mute.
Sorry about that. Yes, no, I think that as we move forward, the next big thing that we need to look at once we have a little bit better control over the acute things are initiatives looking at how do we, in the IDD space, monitor for, detect, protect, and treat the long-term sequelae. Because I have patients that come in, they can say, I've got heart failure, I'm short of breath, but Johnny, Sue, Marianne with a disability may not be able to express any of that. And we know the healthcare inequities in the IDD community. So having an active county program to follow those with IDD and look at proactively and monitor for the long-term sequelae, I really think are something that are an important next step once we get through this step. Thank you.
Thank you so much. And we are now at the top of the hour. I want to really just thank and acknowledge our panelists again. This has been a great conversation. We appreciate all of you, your expertise and insights, and taking the time to talk with us this evening. Unfortunately, we don't have that warm feeling when you're in a room full of people and you can hear everybody providing a round of applause. So I would like to invite you all to take yourselves off mute and just do a round of applause for one another. And I thank you all again for joining us this evening. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Thank you.
Good night.
Night.
Good night.
Thank you all. Have a great evening.
Thank you for inviting me. Good night.
Thanks.
Good night.
Stay safe.